Diabetes in America is unfortunately on the rise.
Not just for our country, but for the whole world. We lack the ability to treat people as effectively as we would like.
I think research in the area is really important, just because there's so many areas where even small improvements can really change the quality of people's lives.
This prize puts the spotlight on extraordinary advances from individuals working in the biomedical research area related to diabetes.
In society, we need more attention paid to diabetes. We don't take it as seriously as we should.
Donors like Mr. Hamm provide a solid basis of support and a framework for researchers to take the necessary risks to move closer to understanding disease mechanisms and finding a cure for complex diseases like diabetes.
We really were privileged to choose amongst the creme de la creme of diabetes researchers. And we ended up enthusiastically with Dr. Andrew Hattersley, who has been a driving force literally for decades in the area of the genetics of diabetes.
Dr. Hattersley is a pace setter in monogenetic diabetes, the relatively uncommon sorts that are caused by single gene mutations.
What he's done is he's identified specific genetic causes of some of these forms of diabetes.
Knowing the mutation, of course, gives us the ability to counteract whatever it is that goes wrong. And with specific drug interventions, he was actually able to pave the way towards a near normal life for a large number of these individuals that were affected by these mutations.
My research focuses on precision medicine, which is the idea that every patient should receive the optimum treatment for their diabetes.
He has cleverly been able to gather lots and lots of blood samples from patients and been able to look at the genes that are involved in the genesis, the development of diabetes.
The way that I approached this initially was defining new genetic types of diabetes. And as we did that, we found these patients with these new causes. When we made the correct diagnosis of the cause, we could then go on and dramatically improve the treatment.
The approach Dr. Hattersley has taken to monogenic diabetes, I think, gives us a way forward for how we would address more common forms of diabetes in the future.
This is really a window into personalized medicine.
Dr. Hattersley is a clear-cut example of an investigator whose basic research has translated immediately into the clinic.
Nothing could ever beat the pleasure and sense of accomplishment that I felt when we heard the difference it was making to people's everyday lives.
We all agreed that the contribution that he has made to the diabetes research field, to the clinical aspect of diabetes, that these contributions are unique, they are tremendous, and this prize is well deserved.
By watching his work over the years, I've really been impressed about how a physician collaborated with people around the world to inform us about how to study diabetes and how to take care of diabetes. So I wish Professor Hattersley congratulations and thank him for his contributions to diabetes.
I feel enormously grateful and honoured to have received the Hamm Prize. I very much feel that this work is not my work, but the work of a whole team. And so this award is recognition of all my superb colleagues who've worked with me in Exeter and all our collaborators throughout the world. And also the tens of thousands of patients who've let us study them and given us samples, which have led to the breakthroughs that we've made.
Andrew, warmest congratulations. Your research has had a great impact, both clinically and also at the bench. I'm so happy for you.
Congratulations. I hope that you're feeling good about this. It really, the reward itself and the prize are wonderful, of course, but what your colleagues have done in recognizing you for the prize is obviously to pay tribute to the hard work you've done.
Andrew, congratulations on the Hamm Award. Well done, well deserved.